Hi, all. So, we're going to be talking about some of the strategies that are being used within the healthcare system, particularly within the pharmaceutical industry, that's being used to essentially create more clients or create more patients. And one of the terms that they use is called disease mongering. I'll explain that in a minute. So, first of all, old saying within holistic health when your only tool is a hammer, every problem looks like a nail. So, in other words, when your only tool is pharmacology, every problem looks like a biochemical imbalance that needs to be fixed with a drug. Um, and as we've seen throughout this course, that's not really the case. Proper diet, regular exercise, appropriate stress management, healthy environment, all these things create wellness. Okay, so we've looked at these quotes before about maintaining order rather than correcting disorder. Within Chinese medicine, um, and basic ideas. Neglecting the core aspects of preventative medicine can result in a huge variety of symptoms of disease. So the first question that should be asked is, what's going wrong? What am I doing wrong? What's going wrong in my lifestyle choices that's creating this disease? So both the healthcare industry, both conventional and alternative medicine, profits off of treating those symptoms of disease. Oops, sorry about that. So there was actually a whole book written. It was called "The Truth About," or it was something like "What the Drug Companies Don't Want You to Know." And it was written by a woman. I have the reference at the end of this presentation. It was written by a woman who was the head editor at one of the main medical journals. So first of all, most of the drug discoveries actually do not occur within the drug companies. They occur at the National Institute of Health or at the universities. And what happens is once those drugs are discovered, they then essentially hand off those drug recipes, if you will, to the drug companies, and then the drug companies will further develop those drugs through clinical trials. About 75% of the drugs that get approved by the FDA every year are referred to as Me Too drugs, meaning that there's already a drug on the market that does exactly what this drug does. They're just trying to get a piece of the pie. That's all. Um, Within 10 years of being released, about 25% of the drugs are either taken off the shelf or they're given a black box warning. You may have seen the black box warnings. They use them primarily for psychiatric medications, but it's basically a warning saying use of this drug will increase risk for whatever, suicide or heart disease or diabetes, whatever it is. When a new drug does get submitted for approval to the FDA, it does not get tested against the older drugs to demonstrate that is an improvement. The drug is only tested against a placebo. And probably 90% of the time, the drug is not more effective than the older drugs. If you can, the recommendation is use the generic drug, and you should probably wait at least 10 years before using a new drug, unless you have some type of a life-threatening situation. Um, and again, a drug only has to demonstrate efficacy when compared to a placebo in 2 clinical trials. So we saw this when we looked at the antidepressants versus placebos. They have 10 trials that show that there's no difference between placebo and the drug. But if it demonstrates in 2 trials that it does work, then the drug gets approved. Um, Drug patents, once a drug is discovered, the patent lasts for 20 years. And that includes the time that the clinical trials are taking place. The clinical trials may take, up to 10 years. So by the time a drug does get off patent, or excuse me, does get through the clinical trials, typically it has about 10 years on the market before that patent runs out. So once the patent runs out, that means that a generic version of that drug can be made by another company. So the drug companies have 10 years essentially to maximize their profits on a drug. Okay, so the FDA, if you read the editorials in the Washington Post, they just crucify the FDA. The FDA gets blamed for the slow approval process, but in fact, the approval process in the U.S. is relatively quick. What happens is the drug companies actually pay the FDA $1 million. I think it is. It's either $1 million or $2 million every time they submit a drug to get approved. So they needed to do that because the FDA was lacking in funding and lacking in personnel. So they said if you want to put a drug through the approval process, you have to pay us $1 million. So The slow point in the process of having a new drug come to market is actually the clinical trials, in particular, recruiting subjects for the clinical trials. Um, when a patent is about to expire, the drug companies do all kinds of crazy things to extend the patent of that drug. That may include actually paying off the generic companies. There are certain companies, drug companies, that specialize in making generic drugs, and the major companies oftentimes will pay off the generic companies to just say, they'll give them X amount of money and say, please don't make a generic version of this drug for at least another 5 years or so. And it actually works out better for both companies. So another thing that they do is they'll essentially invent new diseases for which a drug can be used. So if a drug gets approved for a particular health condition, um, and then they can demonstrate that it is also useful for another to treat another disease, they can extend the patent on that drug. So I'm going to give you some examples of new diseases that they have invented over the past few years. In the past 3 years, there's been $11 billion in fines paid by several of the top 10 pharmaceutical companies. The largest one was in 2011 when GlaxoSmithKline agreed to pay $3 billion in fines. There was a couple different drugs that were involved in that one. Paxil was one of them, the antidepressant, particularly marketing Paxil to children. So GSK had to pay $3 billion in fines. I worked at GSK at the time, and there was talk that the whole company was going to have to get shut down as a result of some of the stuff that was going on. So, as I said, they're running out of ideas for new drugs. So they make up new diseases for which to market and then repatent the older drugs. And I'm going to show you some examples of that in a minute here. Direct-to-consumer advertising. So when you see an advertisement on television or on the internet or in a magazine, the United States is the only country that they're allowed to actually do that. New Zealand is, for some reason, is a country that they're allowed to do that as well. But the U.S. and New Zealand, that's the only place in the world that they're actually allowed to do what they call direct-to-consumer advertising. And they do it because it sells more drugs. When a patient requests a drug by name, they usually receive it. So other countries, they think that's kind of strange that a patient goes in and tells the doctor what drug that they need. The doctor is supposed to tell you what drug you need. Another thing that the drug companies like to claim is that they only spend a very small amount of money on marketing, which is actually true, but they don't consider medical education to be marketing, which it really is. And what they do essentially is get a whole group of doctors and other healthcare professionals. They'll invite them to, these huge meetings, and they basically market their new drugs to the doctors. Okay, so direct-to-consumer advertising accounts for a relatively small percentage of the marketing. Drug companies are responsible for about half of the continuing medical education courses. So it includes informing physicians of off-label uses for drugs. So if a drug gets approved to treat a particular disease, they are only allowed to advertise that it's good for that disease. A physician can use a drug in any way he or she chooses to. So they do not have to restrict themselves to using a drug for whatever it was approved for. So the pharmaceutical companies will market, these drugs for off-label usage, for usage that it's not approved to use. And then the doctors can go and use it however they choose to. So it drastically affects prescription patterns. And then what happens is oftentimes they will invent new diseases. I discussed this a little bit when we talked in psychiatry. Psychiatry is probably the biggest, the group of people that's most guilty of this, especially with things like bipolar disorder, things like that. But it's the selling of sickness. They try to convince people that are essentially that are fine, that aren't sick, that they really are sick. Or they convince people that are slightly sick that they are extremely sick. And it's been referred to as the corporate construction of disease. Again, there's been a whole books written on this topic of disease mongering. So again, basically they come up with a good example. I'm going to give you a few different examples, but the one that comes recently to mind is restless leg syndrome. If you've ever seen that. I don't have that up here on this presentation, but again, something completely innocuous. When we looked at an exercise, a physical activity, non-exercise activity thermogenesis, If you're sitting in a chair and you're moving your legs around a little bit, you're fidgeting, you're actually burning calories. It's actually good for you. But somehow we got convinced that through the pharmaceutical industry that restless leg syndrome is a disease that needs to be treated. And I don't know what drug that they use, but it's probably an antidepressant. So some of the tactics that they use, they take a normal function like restless leg syndrome and imply that there's something wrong with it and that it needs to be treated. They describe suffering that isn't really there. They just define as large a proportion of the population as possible as suffering from this disease. They define a condition as a deficiency disease or as a disease of hormonal imbalance. They get doctors, they pay off doctors to spin this message. Um, they'll manipulate the statistics to exaggerate the benefits of disease. I'm going to show you some examples of that as well. They promote the treatment as risk-free, which there is no such thing as a risk-free treatment, as far as I know. And they take a common symptom that could mean anything and make it sound as if it's a serious disease. So, first example of this was actually back in the 1800s, and it was for Listerine. We all use it. I've used it in the past. I actually stopped using it because of some of the concerns about it. But that term halitosis was actually made up by the group that started marketing Listerine. So Listerine was originally used as a surgical antiseptic. It was then marketed as a floor cleaner and a treatment for gonorrhea. Eventually, it was sold to dentists for oral care. And then that Lambert pharmaceutical company made up the term halitosis, and Listerine was promoted as a cure. So, quote from William James, a very famous doctor back at the time: the authors of these advertisements should be treated as public enemies and have no mercy shown. Cholesterol medication. So, high cholesterol is still the leading predictor of heart disease, without a doubt, and it needs to be addressed. Simply lowering your cholesterol with a statin without actually making lifestyle choices probably doesn't do a whole lot. Okay, so Cheerios actually can lower your cholesterol, believe it or not. That was actually demonstrated. Michael Greger on nutritionfacts.com has a small piece on that. But simply using drugs to lower your risk of heart disease is probably not a good idea. When I mentioned the manipulation of the statistics, if you look at that, Lipitor reduces risk of heart attack by 36%. If you look at the small print there, I actually have a little bit more information here. So first of all, new cholesterol guidelines came out last year, and 8 of the 9 doctors on that panel had financial ties to the pharmaceuticals. The pharmaceutical companies that make those drugs. Statins are very effective at preventing a second heart attack if you've had a first heart attack. But for people that have never had a heart attack but have high cholesterol, the statins actually don't do a whole lot. That 36% reduction in heart attacks that we saw up here from the Lipitor, that actually came from a study that showed that, so they had, let's say they had 200 people, half of them were given the actual statin, and the other half were actually just given a placebo. That's how clinical trials work. So 2% of the people on the drug had a heart attack, while 3% of the people on the placebo had a heart attack. So that means for every 100 people treated with the drugs, actually one person benefited. Okay, so what the more important, rather than they talk about relative risk and things like that, what they refer to as number needed to treat, NNT. So the numbers needed to treat for one person to benefit is 100. So in other words, if you have 100 people that have high cholesterol and that have never had a heart attack, and you give them all a statin, only one person is actually going to benefit from that statin. Okay, and those statins actually have some pretty significant side effects: muscle pain, cognitive impairment, sexual dysfunction. There's actually a lawsuit right now on Lipitor because it elevates risk of type 2 diabetes in women. Now it's a relatively small risk, relatively small elevation in risk of type 2 diabetes in women, but the risk is still there. So it's something that you should consider. There's also a slight elevation of risk of breast cancer too. So this was the most popular drug in the world before it went off patent, and now there's a large lawsuit against the company. So lifestyle changes: go on a plant-based diet. The best way to lower your cholesterol is remove cholesterol from your diet. Cholesterol comes from animal-based products. So get rid of animal products from your diet as much as possible. Have a plant-based diet. Get an appropriate amount of physical activity. Learn how to manage your stress effectively, and that combination is much more effective. That is the combination that Dean Ornish used to reverse cardiovascular disease. Okay, a drug is not going to reverse cardiovascular disease. It may lower your risk. That's it. Stents. So a stent can be very important. It can be a life-saving operation in an emergency. If you look at this stent right here, what they do is it's actually probably much smaller than that. They'll kind of fish that up through your artery. They make an incision right below your crotch in your leg, and they fish that stent up your artery all the way up into right near your heart, wherever the blockage is, and then it opens up your artery. So can be life-saving if you're having a heart attack, during an emergency situation, but they're probably the most overused medical intervention. Somewhere between 10 and 30% of the procedures are unnecessary. And what people would ask, why would they use it? Well, because they make $30,000 off of it, and complications are pretty common. 9 out of 10 patients said that they believed the procedure was going to prevent a future heart attack, but the cardiologist no different. It may help to relieve some of the pain. They call it angina, but other than that, unless it's an emergency, it probably isn't going to do a whole lot. Exercise is actually much better, again, when combined with proper diet, at preventing cardiovascular events than stents. Another thing that they like to do, I can't remember this woman's name. It's there. I don't know. Blythe Danner. Apparently, she's Gwyneth Paltrow's mother. I didn't know that. Somebody in my class told me that today, or the other day. So they'll take an actress, a well-known actor or actress, and promote this idea, promote their drugs or their interventions. So this is about bone mass density and osteoporosis. So bone mass naturally decreases throughout your life. So a woman's peak bone mass density occurs at age 28. So after that, it's going to vary from that peak. It's going to go down. And as it does, they'll say that she is sick. Okay, so studies indicate that about 44% of participants under 65 and 70% of women older than 65, according to their guidelines, have osteoporosis. So a recent analysis of 11 separate studies and over 2,000 fractures found that bone mass density cannot identify individuals who will have a fracture. We do not recommend a program of screening menopausal women for osteoporosis by measuring bone density. That comes from the BMJ, British Medical Journal, one of the most prestigious journals, medical journals in the world. That's in 1996. Okay, so if your doctor is telling you that he or she wants to measure your bone density, your bone mass density, and perhaps put you on a drug, you should probably ignore that advice. Not that you shouldn't worry about your bone strength, but eating a very healthy diet free of processed foods, especially soda. Soda just rots your bones, essentially. So plant-based diet combined with exercise is the best way to protect against osteoporosis, especially strength training exercises, weight-bearing exercises, weightlifting or something like that. Some of the drug facts or the drug claims, they claim that Fosamax will cut your risk of fractures in half. But in fact, Fosamax taken for 4 years results in fractures of the spine in 4% of the placebo group and 2% of the drug group. So it's not, yes, technically it may be a reduction in half, but it's not really that significant. It's really a 2% drop. Number needed to treat, 245 women needed to be treated to prevent one fracture. Okay. Fosamax also causes severe bone, joint, and muscle pain, results in delayed fracture healing, and results in more fractures overall in the long term. Another issue is hormone replacement therapy, HRT. For years, doctors were literally pushing HRT on menopausal women. A friend of my mother's, after years of unrelenting advice, if you want to call it that, from her doctor, agreed to go on HRT, and was like a year or two later diagnosed with breast cancer. So there may still be women that can benefit from HRT, but it certainly shouldn't be used the way that they were recommending. Prostate cancer screening. So we do need to be careful. Prostate cancer is the second leading cause of cancer death in men. I certainly don't mean to suggest that it's not serious, but the PSA, the prostate-specific antigen, is not really recommended anymore. The majority of prostate cancers are very growing tumors. About 10 to 15% of prostate cancers are deadly, but 80% of men being treated for prostate cancer are being treated unnecessarily. Um, at the time of diagnosis, this is the problem. At the time of diagnosis, there's really no way to tell which cancers are going to turn aggressive. So generally, all men diagnosed with PSA detected cancer get the treatment. Again, 80 to 90% of them are being overtreated. Um, Oftentimes, the treatment is not needed, probably does more harm than good. From the U.S. Preventative Services Task Force, many men are harmed as a result of prostate cancer screening, and few, if any, benefit. So, the 15-year survival rate for prostate cancer is 93%. Cancers like pancreatic cancer, very, very serious. Liver cancer, very serious. They talk about survival rates. Usually they talk about 5-year survival rate. So the 5-year survival rate for pancreatic cancer is 3%, meaning that 97% of the men are going to die within 5 years. For prostate cancer, the 15-year survival rate is 93%. That means 93% of the men diagnosed with prostate cancer are still going to be alive in 15 years. Okay, so it's still serious. I don't want to say that you shouldn't get help, but most men are being hurt rather than helped as a result of prostate cancer screening and treatment. From Dr. Otis Brawley, the chief medical officer from the American Cancer Society, says that screening is about 50 times more likely to ruin your life than to save your life. Again, Dean Ornish demonstrated that prostate cancer, just like cardiovascular disease, can be reversed using a plant-based diet, appropriate amount of exercise, and stress management. Other than smoking, red meat and dairy consumption are the primary causes of prostate cancer. Tomato sauce actually lowers your risk, so they recommend to men that we eat 2 to 3 servings of tomato sauce or some other type of tomato product every week. So Harvard has a whole thing about tomato sauce lowering your risk of prostate cancer. We talked about antidepressants already, so I'm not going to. I'll probably skip over this pretty quickly, but they're mass marketing for antidepressants, and it's unfortunate. Depression is very serious. 10% of the population is on antidepressants. There's another 10% of the population at least that is not getting treated, that needs to get treated. But the antidepressants themselves are not really the best way to treat this problem. Several studies showed that antidepressants have very little benefit over placebos. There's serious side effects. About 70 to 80% of people experience sexual dysfunction. About 25% experience weight gain. Almost every one of the school shooters were on antidepressants or were withdrawing from antidepressants, either antidepressants or bipolar medication. So we need to, that's why these drugs have black box warnings. Every one of these antidepressants has a black box warning on it now, especially for children. Exercise is more effective than the drugs for the treatment of depression. It also needs to be combined with therapy. Okay. Other interventions, omega-3 fatty acids, vitamin B3, they can work, but certainly not alone. It needs to be a multifaceted approach. Acupuncture can be helpful. St. John's wort can be helpful. St. John's wort is actually you're not supposed to take St. John's wort if you're actually already taking an antidepressant. It interferes with the antidepressant. So if you're on these drugs, or you know somebody who's on these drugs, and that you want to get off them, you should do so under a doctor's advice, under a doctor's care. Don't just do it by yourself. But I would start an exercise program and a dietary program before trying to get off of the drug. Social anxiety disorder, classic example of disease mongering. This is the disease that was invented by the pharmaceutical industry. They had a bunch of psychiatrists get together, they paid them off to invent this new drug, and it was because one of their antidepressants was about to come off of patent, and they needed a new disease so that they could extend the life of that patent. Okay, so anxiety disorders are actually more common than depression. Okay, but shyness is extremely common. Public speaking is one of the most common fears. Okay, Social anxiety involves significant impairment due to anxiety resulting from any social situation. We used to call it agoraphobia, um, and they had a treatment for it, just like you would treat anxiety. But now all of a sudden, they started marketing Paxil to treat shyness, essentially. And they again they it's the same tactics that they use for the other drugs. They describe as many people as possible as having suffering from this disease, and there's no evidence whatsoever that shyness or depression or anxiety result from a biochemical imbalance. That is a marketing ploy used by the pharmaceutical industry. This was part of what GSK got in so much trouble for marketing Paxil to doctors to treat for social anxiety disorder and other conditions. Um, Another one that was invented to extend the life expectancy of an antidepressant, PMDD, premenstrual dysphoric disorder. Now, painful periods are very common. Usually, it's related to, diet, exercise, acupuncture can be helpful. But this condition, whether or not this really exists, is debatable. The drug Prozac was about to come off of patent, so they invented PMDD and started to repackage the drug, gave it a new name, and then marketed it to treat PMDD. So that's how PMDD came into account. There's actually 11,000 lawsuits right now against the drug Yaz. Yaz is one of the drugs that was prescribed for PMS. So, I would strongly recommend that you look at, I wouldn't say natural methods, but looking at diet and exercise as a way to treat a lot of these conditions. Erectile dysfunction, we've seen this all over the place. Sexual dysfunction is actually very common. Erectile dysfunction is actually an early warning sign of cardiovascular disease. So if a man goes into a doctor's office and says, I need Viagra, the first thing the doctor should do is check in for cardiovascular disease, without a doubt. Okay, so I think I'm going to stop here. I think I've gone long enough. There's a few more that I was going to review, but I think we've gone through enough. Let me actually just skip through real quick to the references. There you go. So you can pause this if you want to check out these references. Actually, I'm sorry, real quick. This is the last one, so I'll do this. Nexium and heartburn. The purple pill, it was Prilosec, and they had Larry the Cable Guy and other people advertising for it. It went off patent, and they came up with the new purple pill, Nexium. It's actually the same exact drug, very slight change in the formula, and again, they repackaged it and called it Nexium. The drug is essentially exactly the same as its predecessor. They claim that it works a little bit longer. So if you have heartburn, I'd highly recommend that and you want to take the drug, I would recommend that you take the generic version because it's the same exact thing. It's just much more expensive for the Nexium. That's all. Okay. So again, here's the references, and hope you enjoyed it. Take care.